ranked as one of the best medical podcasts in Florida. This is the official podcast of the Florida Association of Nurse Practitioners, the premier APRN advocacy organization in Florida for all nurse practitioners. If you're not a member, you should be. Join today. Just go to flanp.org and click on the red box, Become a Member Today. Members get all kinds of perks, including discounted CEUs, including autonomous practice recertification CEUs, insurance discounts, free monthly CEUs, and plenty more. So join today and make your voice heard. Help us help you. We are here to support all APRNs in Florida to practice to our fullest ability of our education and elevate the APRN profession in Florida. I'm Paul Bond, APRN, your host for this show, and I want to thank you for listening to the show and helping make it one of the 10 best ranked medical podcasts in Florida. Stephanie Sanchez, who is a member of the Board of Directors, she is the Region 3 Director and also spearheading the new committee that is the Business Practice Owners Committee. And there's been a lot of good energy about this committee. From what she told me, there were about 50 people who initially have started or wanted to join and help out with this committee, which is fantastic for a brand new committee. We go into a lot of detail about the committee and its possibilities and what her vision is for it. So let's take a listen to what Stephanie had to say. All right, and today I'm here with Stephanie Sanchez, who is a member of the Board of Directors, and she is the Region 3 Director, and she is also spearheading the Practice Ownership Committee that has just started and is getting off the ground. And from what she's been telling me, it's going very well and seems like it's going to blossom into something very, very huge. So, Stephanie, thank you for this time.
Yeah, you're welcome.
So, we were talking a little bit about the Practice Ownership Committee, and if you would just give us a little bit of a background of how did you come up with this thought and what happened to make this come about?
So I have owned my practice for about 2.5 years and managed that practice before I owned it for a number of years, and have learned trial by fire how to run a medical practice, which is a totally different cup of tea than just being an NP and providing care to patients. There is so many different avenues that you have to not only understand, but then become proficient in, such as billing, such as coding, such as even just small business regulations within your city, your county. All of these things I had to learn on my own, and saw a need for others to kind of lead them through this as well. Because I often, as a board member, who a lot of members find out that I own a practice, I get a lot of questions and outreach from members from the top of the state to the bottom of the state about, how did you do this? How do I do that? Where do you start? So on and so forth. And so I put it to the board that what did they think about doing an ownership committee, and got great support for it. So we launched it in September with our first meeting happening October 5th. The purpose of the committee is to empower and support nurse practitioners in their journey towards entrepreneurship, really to strive to provide valuable resources, mentorship, networking opportunities to foster the growth and success of NP-owned businesses. Our committee will be dedicated to advocating for the professional independence of nurse practitioners in the state of Florida and enhancing their business acumen and promoting innovation within the healthcare industry from an NP perspective. And we hope that we can serve as a group of content experts that can then advise the board of directors of FLANP on the needs and wants and legislation for the NP business owner, because that in itself, that entity in itself, has a lot of needs that go unrecognized, unnoticed.
Right. Yeah, no, that's awesome. I think when I first heard about it, when we brought it up at the board meeting, my first thought was, why didn't we think of this earlier? Because to me, getting a group of owners together, even if it would have ended up, obviously it didn't, but if it would have ended up being a very small group, it's a core nucleus of people who have basically FLANP's values at heart, becoming
Right.
truly independent and pushing forward the profession of nurse practitioners.
Right.
You know,
Right. Exactly.
you know, and so it befounded me that when you came up with this, it was like, well, yeah, why didn't we do this before? Why have we not ever thought of this? So I commend you first off for coming up with the idea and actually starting it, and for following through with it. And from what you've been telling me, it sounds like it's going to be a very active organization. Very active.
Yeah. Yeah, I think so, because, a lot of the participants, it's their livelihood too. They've put all of their heart, their soul, their blood, their sweat into their businesses and their practices. And, power's in number too. And we have, I think, as a group for FLAMP, we've always struggled with being a voice that our lawmakers listen to, that those that make decisions for us listen to. And I think this group will be very powerful in that, hey, we're not only NPs, but we are small business owners too. And
Right.
so this is what we need to be successful. It just happens to be the red tape that needs to come down for NP independent practice fully in the state of Florida to be able to open the doors and do the things we need to do. Insurance, the ties and the red tape around insurance, contracting, credentialing for NPs in the state of Florida is a huge barrier for not only access to care, not only affects every NP who practices, but it really hits the NP practice owner, because that means revenue and not just revenue, but sustainability for the practice. So the uniqueness of the NP owner is that you have to not only think about your primary practice, but you have to do other service lines to sustain because of the loss in revenue due to insurance non-credentialing. So
Right.
it's a huge thing to have to bite, and then to have support and others that are in that boat gives you some reassurance, some confidence too, like, oh, I'm not the only one in this, because it can be very lonely. I know I felt that way when I first started myself, like, who do I turn to? What resources do I have? Who has any NP before me done this before?
Right.
So yeah.
And there aren't a lot of resources that understand the dynamics of Florida law.
Right.
There's some resources for business, for nurse practitioner business, for adding service lines, but a lot of it kind of goes around either being fully self-pay or in truly full autonomous states.
Right.
And neither of those necessarily fit Florida very well. If you want to go cash only business, that's one thing, but there are hurdles with that also. And especially with Florida having a higher Geriatric population, you now count most of those out because they're already on Medicare.
Mm-hmm.
So, that becomes a whole different dynamic with billing. With, you can't charge the patient for something Medicare pays for. So you've got to opt out of Medicare to do it, which then you cut out every bit of insurance billing that you could do.
Right.
So that kind of makes it hard. And then, as you said, with not being able to be impaneled very easily in Florida as a nurse practitioner, you have to be creative in how you find your finances to keep your business afloat.
Exactly.
It's a sad state when we've got to talk about money, but the truth of the matter is, if you're not making money in business, then you can't stay in business, so you can't take care of patients.
Exactly. A totally different dynamic than just worrying about your primary practice and how you're going to treat these patients, for sure.
Right. And from a physician standpoint, while primary care is being crunched from both sides, no matter what level of education you have, I see that physicians have it a little bit more easy because they're already established. They can become impaneled. Period.
Right.
In Florida, nurse practitioners can't for many of the insurance companies. So right there, they have a leg up to begin with.
Right.
And the same is true for hospital credentialing. We as nurse practitioners can be credentialed, but it's up to the hospitals to choose to credential us without having a physician collaborator, which most won't do.
Right.
So even at that, if you have patients, you can't go see them in the hospital unless you have a physician collaborator.
Exactly.
So yeah, I see this as very much furthering our cause. And as you said, and we've talked about it numerous times, is, votes count. And constituents for the people that are in Tallahassee are the ones that they're going to listen to, even though there are special interests that pay money and those types of things. They still have to have the votes to stay in office. So if their constituents are wanting something loud enough, then they're going to listen. And especially in the climate today, whether it be local, state, or even federal, now with President-elect Trump coming in, we're looking at the economy. We're looking at deregulating a lot of businesses in certain ways, or minimizing the red tape, as you mentioned. So I think it's coming to a perfect storm, if you will, of getting nurse practitioners more involved and getting true full practice for us and for other states around the country. And business is one great way to push that, because if you want to expand the economy, and you want to have more business, well, here it is.
Exactly. You get it. Sure.
Yeah.
And there's so many different ways you can go about this, so it's definitely going to be very fluid, and very, NP centric, I mean, FLNP prides itself on trying to be, member centric. And so I think this aligns very well with FLAMP's mission and objectives in so many different ways. And then we help our fellow NP. In fact, I have a lot of people that contact me, a lot of NPs across the state, and I try to help them out. I've had it where those that want to learn real time, they've asked if they can shadow me or come and see what I do, and I'm very open to that. I've had now 2 NPs, one who I'm about to let fly, and we do it helps me out too, because I'm a sole practitioner in my practice. So I have a a reduced hourly rate to teach you how to do your own practice. So you see my patients, the same time I get help and support. And you learn the ins and outs real time of almost like an internship, if you will, for business.
Right. No, I think that's awesome.
Yeah. I have another one coming from Miami, and she's actually coming next week. So, yeah. So I try to help out the fellow NP. I'm not a stickler of like, oh, this is, we're in competition, because there's so much work out there. There's so much good that all NPs can do. So,
yeah. And physicians and nurse practitioners, if you look at healthcare, medical care in Florida, we are behind in how many people we have to be able to treat, how many people need treated. So we really shouldn't look at it as being in competition with each other. There are, for lack of a better way of putting it, there are plenty of patients to go around. There are just in Flagler and Volusia County, we're down probably 50 to 100 practitioners, at least, in just primary care. If you look at the numbers from the state and from the federal government for the ratios of provider to patient, patients wait 2 to 3 weeks to get in minimum to see a practitioner as a new patient. And even as established patients, a lot of them can't get in for a week. Well, if you have a UTI and your provider's not going to do anything outpatient without seeing you first, you could have pyelo in a week.
I know, it's crazy.
So, to look at it as being competitive against each other, I don't think that's the right mindset. And you have the right mindset. I think it should be more collaborative. We should be working together, and building a community that can help and support each other. And you mentioning doing mentoring as you are, I can foresee that becoming a very big part of what the committee does and what FLNP pushes, because mentoring is one way to get the next generation involved and move everything forward. You're on mute.
Sorry. Exactly. I foresee I'm going to need a co-chair, because I envision that this is going to get, the more the word gets out, and we're just shortly in the 2 months of it being active. And I think I'd have to look, but first meeting, we had 30 people who clicked on the link to join the meeting, and 16 attended. And I have, last I looked, there's over 50 asking to join the second meeting. So we'll see how many show up. But
wow,
yeah,
that's fantastic.
Yeah,
I can see you're going to have to break off into subgroups, and it's going to be hard to control as it grows that quickly, which is a good position to be in. That's a good problem.
Yeah.
If you're going to have a problem, fast growth like that is one that you want to have. So,
I think FLNP too, and not to go on a different tangent, but recognizes this as a need, that our members are needing this kind of support, so much so that we're planning on doing a separate business track at our upcoming conference.
Right.
So, yeah. Right. And it's something I think that we stand out from other NP organizations within the state of Florida, offering this. We're the only one offering business ownership support right now.
Right, right. And along that same line, in pushing for true full practice, we also embrace all nurse practitioners, not just the FNP.
Right.
Because obviously, and there are many more, but just looking at mental health, there's a massive mental health hole gap in the country, but in this state. And mental health nurse practitioners could do a lot to fill that gap. And bringing them in for business would be another way of helping. So, yeah, I agree. I see this as a wonderful thing for FLNP, but for nurse practitioners and also for patients in the state of Florida.
Mm-hmm.
Now, you said you had your first meeting in October, right?
Correct.
Okay, and your next meeting is when?
December 14th at 9 a.m. It is set currently for every other month, second Saturday of the month at 9 a.m. And those meeting, you have to be a member to participate. And those meeting calendar is on our website, flamp.org. And you click on calendar from the homepage. You'll see the list of events and activities, and you just click on that meeting. It'll take you right to the link to register for that meeting.
Cool. And you also said that you're starting within the website for members, you're starting a forum for the business practice ownership, correct?
Yes, that is correct. It is now live as officially yesterday. When you go to your homepage on the right side where it says my feeds, if you go a couple of lines below to groups, select groups, you'll see the list of groups, and you can click APRN Practice Ownership Group. And that is open to all members. You don't have to register for that forum. You can go and stalk the forum and not even say anything and see what's on that. There's blogs, there'll be resources, and items, probably the past meetings will be housed there as well. So a boatload of resources will be up and coming at that website.
Right. And I expect that to grow also with other, as the committee grows and the business community grows, sharing resources, sharing forums,
Exactly.
sharing, just as we were talking, having a preferred vendor list for whether it be pharmaceuticals or office equipment or EHRs or whatever,
Yeah. The sky's the limit.
Yeah, right. So you have to be a member to join.
That is correct.
So if people are not a member of FLANP and want to get involved in this, please sign up for FLANP and become a member and help us push for true full autonomy for nurse practitioners in Florida, as well as other things. We're working also on the legislative front to try to get better credentialing for insurance. And right now, currently, we're going to try to push for true full autonomy for mental health nurse practitioners.
Yep, and we're going to promote any willing provider language and any specific bills that are being written that would impact NPs.
Right. And members can also get involved in the legislative committee, which is working on those things, staying in front of them, obviously. And also, marketing to our constituents, the people around us, and to the legislators to try to get these things passed. So membership has a lot of advantages, has a lot of opportunities for people to get involved. And this committee obviously is one huge way. If you as a nurse practitioner are thinking about becoming a business owner and becoming autonomous and putting yourself out there, or you already are and you're struggling with things, or you see things that could be changed, or you got questions. This committee is one way to get involved and get answers, give help, and forward the practice of nurse practitioners.
Absolutely. And our next meeting is December 14th at 9 a.m. We will be doing some education at every meeting for items that are hot topics for NP business owners. And at the December 14th meeting, we will be having a speaker about value-based care and ACOs, which is very important for business owners to understand and to get on the bandwagon, so to speak, as we are going from fee for service, which is what everybody knows, to value-based care reimbursement. So it's something that's crucial for business owners to know and understand.
Yeah, most definitely. Most definitely. So now, Stephanie, if anybody wanted to get a hold of you specifically, what would be the best way to do that?
Email at Steph Sanchez 1027 at yahoo.com. That's STEPH SANCHEZ 1027 at yahoo.com. And you can also go to flamp.org's website and hit Region 3, and there is a link to my contact there. And those would be the best ways to reach me.
All right, great. And for those who are not members that are listening to this, who want to join FLANP, go to that same website and click join or become a member, and you can sign up right there. It's a nominal fee of $100 a year to join as a full member. And you can then join the practice committee and start getting involved.
Yes, please do so. I look forward to helping any NP in business.
That's fantastic, Steph. I applaud you for your work, and as the education director and obviously the podcast host, I'm here to support you and help in any way that I can. The board is 100% behind you, and I think this is going to be a fantastic committee.
Thank you. Thank you, Paul.
You're welcome. And Steph, again, thank you for this time this morning. It's a Saturday morning when we're recording this, and you and I both, just like everybody else, has a lot of other things going on and a lot of other things to do. So I appreciate you taking this time to do this.
Of course. Anything for my fellow NP.
And once again, I'd like to thank Stephanie for taking the time out on a Saturday to be interviewed for the show. I look forward to a lot of great things coming out of the Business Practice Ownership Committee. And if you are interested in joining the committee or helping out, please feel free to contact the association. You can do so through the website at flamp.org. We'd be happy to have you. There's a lot of exciting things going on with the association, and 2025 looks to be another banner year for us. So if you're not a member already, consider joining up and adding your voice to ours to help advocate for the practice of nurse practitioners in the state of Florida. This is Paul Bond for the FLANP podcast. FLANP is the premier organization for all nurse practitioners in the state of Florida. And as always, thanks for listening and have a great day.